Increasing LPN skill and confidence in managing Alzheimer's dementia patients. Needs assessment background. Dementia has been described as a silent epidemic. The World Health Organization has determined dementia to be a public health priority. 5 million people live with dementia in the United States, and it is the 6th leading cause of death, killing more than breast and prostate cancer combined. This number is expected to double by 2030 and triple by 2050. Dementia creates a caregiver and financial burden. 15 million Americans provide unpaid care at an estimated 18.2 billion hours valued at $230 billion. All-cause dementia cost the United States $250 billion in 2017 alone. By 2050, these costs are predicted to rise as high as $1.1 trillion. United States Preventative Task Force does not recommend routine screening for dementia, but does recommend treatment focused on recognition of signs and symptoms and improving quality of life, mood, and behavioral impairments. CareMore Medicare Advantage Plan provides insurance and a provider serving 75,000 seniors in California, Arizona, Nevada, and Virginia. Patients are seen weekly in group homes, assisted living facilities, and memory care units. 75% of CareMore patients suffer with cognitive impairment. Doctorally prepared APRNs are in a unique position to serve as effective collaborative team members, employ strategies that enhance communication with other licensed professionals and frontline staff, respect and understand the complementary roles and abilities of the health team, implement and evaluate quality improvements, and introduce and teach evidence-based practices. Why does this matter? Treatable causes of dementia must first be ruled out. Depression, thyroid disease, and drug interactions are 3 of these. Therapeutic and professional communication with patients with Alzheimer's disease and their caregivers improves quality of life for both. Barriers, fear. Dementia is the most feared health-related concern in people over 55. LPN lack of knowledge, LPN lack of education, and ageism among healthcare providers. Description of learner, LPNs, mid-20s to mid-50s, years of experience, 3 to 18 years. Primary language is English. 40% are Caucasian, 40% Hispanic, 20% African American, 80% are female. Educational level is LPN, a 1-year degree program. Learning goal and objectives. The goal of this teaching project plan is to empower LPNs at CareMore Medicare Health System in providing evidence-based care of patients with Alzheimer's disease and achieve 100% compliance with documentation of MMSE in patients' charts 1 month following the presentation and simulation training. Objective 1, at the conclusion of the presentation, the LPN will be able to identify and verbalize 3 signs and symptoms unique to Alzheimer's dementia. Objective 2, at the conclusion of the simulation training and presentation, the LPN will be able to correctly administer and document the MMSE. Objective 3, upon completion of presentation and simulation training, CareMore LPNs will be able to work as a group to create a plan for implementation of 3 evidence-based strategies for management of the patient with Alzheimer's dementia. Method of instruction is simulation. Simulation exercise uses standardized patients who are actors. It's cost-effective. The actors are instructors that do not receive additional compensation. It engages learners from all backgrounds and educational levels. And LPNs are provided with a copy of the MMSE and case studies prior to the simulation exercise. Advantages: it develops problem-solving skills. It's interactive, can be customized as skills are honed. Learners are engaged in a safe learning environment, and it promotes teamwork. Disadvantages: real-life situations are not always recreated accurately. It can be expensive if simulators are used. Review of literature. Randomized controlled trial of the effectiveness of simulation education, a 24-month follow-up study in a clinical setting. Nursing students' experiences with high-fidelity simulation. The performance of standardized patients in portraying clinical scenarios in speech-language therapy, and simulation-based learning in nursing education, a systematic review. Synopsis of literature. Simulation is an effective learning technique that promotes a safe, non-threatening learning environment for nurses and nursing students. Simulation provides collaboration and enhances critical thinking skills, allowing students to learn by doing. Although simulation can be anxiety-producing, students report increased confidence following simulation exercises. Simulation facilitates nursing student development of clinical judgment, increases knowledge, and self-efficacy. Technical skills are honed in an environment that is safe for both students and patients. Compared with lectures, simulation provides real-life experience and the in-depth understanding that comes from combining multiple learning modalities. Learning theory integration. Teach me and I'll forget. Tell me and I may remember. Involve me and I learn. Benjamin Franklin. Simulation-based learning is based on the work of David Kolb. It is useful for nursing clinical experiences and assists a learner in accomplishing learning goals. Who benefits from clinical simulation-based learning? Learners of all ages, from different cultural backgrounds, with different levels of experience, that have difficulty learning from lectures or textbooks, that learn best from a hands-on experience, that enjoy teamwork or can benefit from learning to work as a team. Outline of teaching content. Objective number 1. At the conclusion of the simulation training and presentation, the LPN will be able to identify and verbalize 3 signs and symptoms that are unique to Alzheimer's dementia. Content: review the clinical presentation of Alzheimer's dementia. Method of instruction: guest speaker from the Desert Southwest chapter of the Alzheimer's Association and instructor lecture. Time allotment: 2.5 hours of classroom time plus 1 hour of outside class study time. Resources are retrieved from alzheimers.org. Objective 2, at the conclusion of the presentation, the LPN will be able to correctly administer and document the MMSE. Content: how to correctly administer the Folstein Mini Mental State Exam. Method of instruction: lecture, video, discussion, and handouts. Time allotment: 2 hours of class time and 1 hour of outside class study time. Resources are retrieved from Dementia Today. Module 3, upon completion of simulation training and presentation, CareMore LPNs will be able to work in groups to create a plan for implementation of 3 evidence-based strategies for management of the patient with Alzheimer's dementia. Content: review of evidence-based strategies for assisting and managing the patient with Alzheimer's dementia. Method of instruction: lecture and simulation exercise using standardized patient. Record LPN interactions with the standardized patient. Time allotment: 3 hours class time plus 1 to 2 hours outside class study. Resources are from the Alzheimer's Connection. Evaluation: sample evaluation questions, module content. Upon completion of the modules, do you feel like you can recognize the early signs and symptoms of Alzheimer's dementia? Do you feel that you can accurately administer and document an MMSE? Did the simulation exercise help you to feel more confidence in interacting with a patient with Alzheimer's dementia? Sample evaluation questions, method of instruction. Was this course organized in a way that helped you learn? Did this course provide an appropriate balance between instruction and practice? Did the simulation exercise help you to develop communication skills? Did this course improve your problem-solving skills? Additional resources for each module are included and expected to be learned by the students. References are here and here.